Tanya Kubjanani Vatsa. I'm the CEO and founder of Elixir Wellness. And I'm here today for an episode of Spilling Facts. I'm here with Dr. Aishwarya, who's joined us recently and has a really unique background. I'd love for her to introduce herself and then tell you more about what she does and what some of her favorite therapies at Elixir are.
Hello everyone, my name is Dr. Aishwarya. Thank you so much Tanya for that lovely introduction. This is also our first footstep in the digital platform because we are finally starting the podcast series of Spilling Facts. So I have done my undergraduation in India, which is my MBBS. Then I pursued my memberships of Royal College of Physicians from United Kingdom, and at the same time I'm super specializing in anti-aging as well as aesthetic medicine. So that's me, and you could ask me all the questions related to your skin, wellness, as well as longevity.
So I'd love to start with this. Given how unique your background is in this space and what we do, how do you believe it adds value?
I think longevity is something that all of us must focus upon because we have seen our parents suffer. We have seen people who are really close to us suffer, and it makes us wonder once in a while that we would be in their shoes and we would be in that position in some point of time. So this journey is very personal to us, and everything and anything which helps add value to our health then makes a super integral part of our life and must be a super important part in our life.
Absolutely. I was actually reading something interesting last night about how the lifespan average age has increased, but
True.
It's because of the death rate of infants going down.
True.
So it's not like we've been living significantly longer, it's that the average has gone up because the bottom has come down.
Right.
But now with medicine and science and the advantages, we can actually get to a point where the cap of how long we live, how long the oldest person lives, will increase and come closer to the average.
Definitely. Like, while that is a benefit and that is the pro of all of this setting, what I feel that it also comes with certain cons. So earlier, if we see, the quality of life was much better. Simply the air that we were breathing in was much nicer, and so it introduced us to fewer diseases, and it causes fewer precursors which would then lead to serious outcomes disease wise. So we will have to be mindful, and we will have to definitely invest in our health via wellness to ensure that we maintain the quality of life that we had earlier.
Absolutely, I couldn't agree more.
Exactly.
So Dr. Aishwarya, what is your favorite wellness service?
Well, to simply talk about it, I think hyperbaric oxygen therapy would be my favorite. It's because it gives me access to the best of best quality of oxygen that's available on the planet, and at the same time it helps with anti-aging, it helps with wellness, and it has helped so many people with their heart related issues as well as lung related issues that I feel it's simply amazing.
So I personally have taken the hyperbaric oxygen therapy at Elixir, and one of the things I love is how meditative it is.
It is.
Sitting there, it's calm, so I go in with my iPad and read, but you actually have to consciously breathe in that oxygen, and it's such a meditative and relaxing experience.
Right.
More than that, the value that it's adding, there's studies after studies showing how hyperbaric oxygen can directly increase your telomere length, and so it increases your longevity.
Right.
So Dr. Aishwarya has done a lot more than just longevity. She is working on an MSc in anti-aging and skin as well, in addition to all her fabulous experience. So I'd love to ask her, what is your favorite anti-aging treatment for the skin?
Right, so if we talk about what's in right now, people are going after fillers, they are going after neurotoxins, but I personally feel the most natural and the beautiful way to age would be using skin boosters for our skin, wherein we are harnessing the natural collagen in our body to sort of create that glow for us, to sort of create that skin for us, which is not only healthy but is also natural to us. And so we don't look natural because of the artificial substances that we do put in, but it's our own body working for us to look our best.
That sounds amazing. I've seen the results from skin boosters, and that glow just looks fabulous.
It is.
So Elixir Wellness actually started as a small IV therapy center, for those of you who don't know, out of one room, and from that we've expanded to a chain of 26. IV therapy is something that we started with and is something that's very close to my heart. I'd love to ask Dr. Aishwarya her opinion on IV therapy.
Well, I think, to simply put, IV therapies are brilliant because taking oral supplements every day first of all, is hassle. Second of all, if we are to take the oral supplements, what happens with it is it goes at least via two passes of metabolism, and after these two passes of metabolism, which is like once via your gut and once via your intestines, whatever is left then gets absorbed in your system. When we do take intravenous therapy, what happens is that we skip the whole process, and the bioavailability of those nutrients to us definitely increases. And what then this does is that it gets rid of the hassle that we spoke about, and second, the nutrients are working in a much nicer way for us, is what I feel.
I personally have seen a world of a difference with IV for myself, which is why I'm so passionate about it.
I simply agree with this. Like, even I have seen so much of difference, not just with the energy levels, but the way my skin looks, the way I sleep. It's amazing.
So for me, it's been sleep, skin, and also migraines.
Yeah.
So that's been an absolute game changer for me. So let's talk longevity, doctor.
Right.
What are the aspects that one should look at when we talk about longevity and increasing your lifespan?
Right. So let us try and understand what the whole concept of longevity is and why is it being highlighted right now. So ever since the start of the time, we have been only focusing on curing the diseases once caused, but now we have moved to a mindset wherein we want to know how the diseases are happening so that we then prevent it from happening and prevent it from occurring. And what this will do is that it will take a significant disease load both from the patients as well as the healthcare practitioners in the world. So that is longevity. Now, speaking about it, just in aesthetics, how we focus on how our external appearance is, how we cosmetologically look beautiful. Longevity helps us identify how our organs are working, how they can work in a better and a healthier way. And so what it entails is that we try and do the prognostic tests. If there are family history of certain diseases, we try and do those test panels to see where we are at. It simply helps us understand what works and what does not work for us. So starting with the food that we consume, the diet that we have, the exercise we follow, and the exposures that we have, they all could play a part in what as an individual we would be in the next 5 years. Supposedly we will take more conscious decisions, and that's what longevity is all about.
Okay. That's a really interesting take on it, actually, especially because there's a lot of buzz right now about risk assessments for certain diseases, and so I think this fits in really well, and I'd love to see how together we can take Elixir in that direction as well.
Definitely. I think this was one of our conversations.
Absolutely.
The one that you and I had about how the whole space is changing and how we would be then actively taking steps and measures to introduce this in our practice.
So stay tuned for that as well coming up at Elixir. And I'd love to ask you a question that has been another one that's all the talk and buzz right now, and that's gut health.
Right. So about gut health, what I feel is that the food that we have been consuming for a really long time, we cannot assess its credibility, the sources that it's coming from, and so it's in its most impure form. What I mean by that is that it is not at all healthy to your gut because it is so processed. So we need to now focus on foods that are more organic. We need to now focus on nutrients via IV therapy, which helps us absorb those foods, substances that we are consuming. And so all in all, what that will do is it will take the disease burden of IBD, it will take the disease burden of IBS from us, it will cause a lot less bloating, and this would significantly improve the kind of day that we are living, or the kind of day that we are having.
I think a lot of people are now suffering gut health issues but don't want to speak about it because
Right.
they're embarrassed, or they feel like it's not something that they're comfortable talking about, but
True.
it's something internal that can even affect your skin, it can affect your hair, your vitamin intake, your
Yes.
health quality, and of course the quality of your day as well.
So I read this somewhere, Tanya, and it's very interesting. So your gut health and your mental health are two pods in a pea. So what that means is that if your gut health is not right, your mental health is not going to be right. If your mental health is not going to be all right, your gut health would suffer. So if we are to take measures to significantly improve our gut health, then that also means that we are mentally and physically in a better state. So that's super
That makes a lot of
yeah.
sense, and that's a really interesting thing too.
Yeah.
I mean, my mind immediately went to anxiety patients and how do they feel.
Exactly,
So
like
it's,
how do you get those gastric episodes when you are in your anxiety or when you are
Absolutely.
experiencing those episodes?
even with children, the moment
Yeah.
they're stressed, it's a stomach ache that
Yeah.
they'll come and complain
And the sugar
about.
rush that they get after consuming sweets, have you seen
The
that?
sugar
The way
rush
they
and then the
dance
crash.
it? Yeah. Yeah.
So coming to the next one on skin,
Right.
as an injector, which we know you're Dr. Aishwarya is an expert injector, I'd love her opinion on preventive Botox and fillers,
Right.
because that again is something that's absolutely buzzing.
Right. So neurotoxins and fillers, both of these things are my absolute favorite, provided how you use them, provided how the practitioner knows the anatomy, provided when the practitioner knows when to say, okay, this is where I draw a line, this is where I would not be injecting anymore. So talking in terms of preventative Botox, it is something which helps you not only get those lines in future, but it helps you age gracefully. And I think we have for the longest amount of time focused on how the skin quality improves and how everything else goes on. Aging gracefully is a right, and aging gracefully is a constitutional right to everyone. And I think it's so important now is because people simply want to, as we just discussed, how they're living longer, they want to look better as they age, they want to look more presentable, because it brings that inner confidence, it elevates the standard of living that they have. And so that's where the role of preventative neurotoxins come in. So instead of the higher dosages that we use, for example, to treat lines, we would be using much smaller doses.
Okay.
And this would be then done in patients who really need it. Like for patients who really need it after their skin assessment, this won't be blindly done to everyone. Like how the whole buzz is right now, once you're 30, start using retinol with no
Absolutely.
clinical trials. So that's something that we would like to introduce in this space. And same
Absolutely.
goes with fillers. I mean, fillers help you fill the lost fat which has been reabsorbed from your facial area, and so it happens to both men as well as women. And to get back that symmetry and to have that more youthful and more rejuvenated look, people are now opting in for both skin boosters that we spoke about and the fillers. But again, this you have to be mindful about who is injecting it, where are you getting it done, and please do not trust people based on the limited resource that they would have to back the claims of their injections.
Absolutely, that's a great way to put it.
Thank you.
So my next question, and this is another, so I think we're hitting all the buzz points today,
Yes.
but exosomes is something that
Right.
we've discussed and something that
that's
we keep
my
seeing on the
absolute
internet.
favorite.
So Dr. Aishwarya, what are exosomes and how are we using them?
Right, so I would be, delivering this information in a very palatable way, because this is a very scientific component. And so there are cells in our body which rejuvenate when there is an injury or when there is a harm to our body. So now for these cells to act properly, there are certain messengers that it needs to act in a certain way. So what happens is that in cosmetology especially and dermatology, we do create those micro injuries in terms of microneedling, in terms of MNRF, or in terms of Morpheus, whatever it is. And so what exosomes do is that they act as messengers for these injuries that we have caused, for them to heal better and in a much nicer way, so that you end up having a better skin. If used wisely in your hair, you end up having better quality of hair and hair growth. And I think it's simply brilliant what this simple molecule can do. It's amazing.
We've seen fantastic results. So we started with
Right.
exosomes for hair,
Yeah.
and you can actually see male pattern baldness and patches filling in, which to me was a surprise. I didn't think it was something we could achieve without a hair transplant.
True,
but it's
true.
phenomenal to see that happening with
Yeah.
literally with a little vial of exosomes mixed in with our PRP.
True. And the brilliant part about exosomes is that it can also be injected, like some people are injecting it, but in my practice I also do a lot of topical exosome application. So to just cite as an example, I had a patient with a lot of scar tissue build up as a result of cool scalp or fat cavitation that they've had. And so what I put her on was repeated sessions of MNRF, or else Morpheus 8 as we call it, and I topped it off with exosomes. And she is super happy with the kind of recovery that she is experiencing. She's super happy with the skin quality that she is now getting. And so that's why it's brilliant how we could also inject it, but also the topical application is giving such nice results. That's commendable.
That's great to know, and it's actually so nice when we see happy clients talking about their results, coming back, bringing their families back, and we've had a lot of that, which has been incredible.
Yeah, that happens to us. Like, they see how the whole thing works out for them, and obviously they would have their best interest for their family in heart, and so they come back with their family. That's such a sweet gesture.
It's amazing.
Yeah.
I mean, I know we've had Sundays where people have come back immediately.
Yeah.
Not even like send someone a few days later, but I know clients have come back to you in the same day with family members.
Yeah, that's so nice of you. Thank you.
My last question, Dr. Aishwarya, is what are polynucleotides and how do we use them?
Okay, so polynucleotides are a form of skin boosters, and I would again try and put it in a very palatable and a very easy way. So they are a type of skin boosters. Now they have been used in different sorts. They have been used with different extractions, and right now what's really buzzing is the infusion of salmon DNA, because it is so close to the human DNA, in a polynucleotide form, which is then used topically, or it is most of the times injected in the skin. And so it gives the most natural skin, it gives the most natural lift. So what people are saying and what the claims have shown, I am not so sure about the clinical trials to back this up, but what the claims show, that they have achieved reduction in fine lines, they have achieved reduction in skin laxity, and they have also achieved reduction in the type of fillers and the quantity of fillers. So it has gone much down, the requirement of those fillers and neurotoxins that we are injecting in patients. So I think this is set out to be something which might replace fillers and neurotoxins in future. That's the claim.
That's really fascinating to know.
That's quite fascinating, and we are coming up with a lot of things, and I think it's always interesting to sort of have that conversation with your practitioner and try and get to know where we are at right now. And so I would just want to touch base with you about the non-invasive techniques that we also offer. So
absolutely.
I mean, for somebody who is listening to this podcast, they would also want to know about certain non-invasive techniques where nothing is being injected in the face.
Yes, for sure.
That's a concern of audience here natively. So what do you have to say about the non-invasive procedures?
Honestly, we have a plethora of them. I personally have not had anything injected in my face.
Right.
My veins, of course, because I love my IV, but I know we have from radio frequency to HIFU, crystal light, we have some incredible technology. So from those, Dr. Aishwarya, what are you using the most and what has been your favorite so
to be very honest with you, I haven't injected anything in my face as of now yet, because I'm super young and I don't think I am at that stage in life where I would need injections. But I have used non-invasive methods. I have used high intense focus ultrasound for my neck and my underface area, and I think it has given me a brilliant jawline. And talking about the crystal light and the new facial that we are introducing at Elixir, what do you have to say about it with its infusion with intense pulse light, that is IPL?
So I think we've both tried it out,
and
I absolutely love the glow that I got from it, and
exactly.
and I think it's hard sometimes to see it on your own face, but I know when you did it in minutes, I was like, what have you done? It's looking amazing.
Yeah, and I remember, and you know what's so special about that treatment, that it's got two probes. One is the crystal light probe, which gives you that nice glow, but the other probe is an absolute champion because it helps you disintegrate all the pigment from your face, it helps you reduce freckles, and it also helps you sort of reduce any of the acne scars that you would have. So it's an amazing technique, and I think a very few people in Bombay are doing it. I
don't think anybody else has that machine because it was proprietary and new. We were the first order. It was something we took a chance on. Of course, now it's been used across the country and they have studies and papers and stuff on it as well. And it's something that BBL and IPL light have been used abroad as well.
Right.
So their safety and everything is completely tested. But I've used it on my own face, so has Dr. Aishwarya, and we're really happy with the results.
Yeah, and so are our clients. Like, do you remember the two clients that we've had last week? They're super happy with the sort of glow that they have achieved, and those stubborn melasma marks.
But even for me, I have such stubborn freckles, and I felt in one session I could see a difference.
That's amazing, and this is something that we are introducing at our practice, so stay tuned, and we have so much in the back for you, trust me guys.
Absolutely, lots more coming your way, so stay tuned to our YouTube and our Insta as well for updates. And of course, I hope you enjoyed this episode. We'll be back with more soon.